Welcome. This is Jason Clemens, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemens, DC. We are live right here in the Rock Health and Wellness Center studios in Lubbock, Texas. We're live on the radio at 98.7 Walk by Faith. We're live on 1420 AM for all you guys out there, 987radio.com. We're on social media at the Rock Health and Wellness Centers, on Facebook. We're on YouTube at Health from the Rock, and we're on X at Jason Clemens DC. We're live and we're ready to go, and I hope you guys have had a fantastic day. Like always, we've had a fantastic day at the Rock Health and Wellness Center. We've been doing wellness. We've been doing wellness things today. It's inspiring to do wellness things. So, and tonight we're going to just keep it going because we've done some breakdown this week. We broke down flexion extension, like really got into it, broke it down. Last night we broke down plantar fascia and plantar fasciitis and looked at some pictures about that. So tonight I thought, you know what, we're just going to keep the theme going, and we're going to talk about sciatica. And what exactly does that mean? Because people say that all the time. Doc, I think it's my sciatic nerve that's messing up. And so let's break it down tonight. Let's get with it. And let's really get serious about it, and we'll break it down. So that's what we're going to do. Probably it may be the second half of the show or the later on in this part of the show before we get to it. And so that's what we got going on tonight. We're gonna do all that, but first we're going to talk about some conversations that we've had and some conversations that we had today and some cool things that are happening at the Rock. First, before we get started, if you've got a text, you want to send me something, 806-794-0400. That's our text line. That's our office phone. That we have a cell phone as our office phone, so you can send me a text if you would like. You can send me a chat on any of the social media. Send a chat to us, and we'll take care of that as well and see if we can answer any of your questions. So if any of that, I'd love to hear from you. I'd love to hear from you guys. If there's something that's on your mind, something that's on your mind about health, something we don't cover on this show, something that you might have missed, or if you've got something that's bothering you, we've got some cool stuff that we do here at the Rock, and you might enjoy some of it. So, some conversations. It was really interesting. I had a couple conversations today that stemmed from some scripture that I read in the last 2 mornings. And I have a pastor that I take care of that comes and gets adjusted. And he usually breaks down the sermon for me, that what he's got for me this week. And I told him, I said, hey, I got one for you. I got an idea for a sermon. And he said, okay, what do you got for me? And I said, well, I'll tell you what, because Monday nights we do Taking Health to Church, and you guys know how that Monday night was pretty good. I went back to Facebook to try to find it today, and it's not there. And what would that be? Let's see, because we're live now. Let's see, are we live? Yeah, we're live now. And then that was 1 day ago. 2 days ago would have been, yeah, it's there. 3 days ago. I didn't see it earlier. But we were talking on the Taking Health to Church on Monday night about keeping your eyes on the Lord, making sure that we're not getting, disrupted by what was going on with us bombing Iran and all that sort of thing, right? And I thought Hillside Church did a really good job of that on Monday, keeping everybody focused. And the message that I got, one of the scriptures was John 14:1. Do not let your hearts be troubled. And in John 14:1, it was kind of got me thinking. So I had a little time on Tuesday morning before I got started. Wednesday morning before I got started, I had a little time. I was having a cup of coffee, and I was thinking about my day and what we were fixing to do, because Wednesdays are kind of long. We start at 7:30, and I just thought, you know what? I'm going to read that whole chapter, that John 14. I'm going to read that whole thing. And so I did that, And what was really interesting is how many times during the day I had a conversation about the scripture that I had read that morning. And you would think at 54 I would already have figured that out. Like what, and it just happened to be the very next day on Thursday. So yesterday morning, I just decided to read John 15. No, today is Thursday. That was this morning. I don't even know what day it is. This morning, I had some time, so I just said, you know what, I'm going to just continue this theme, and I'm going to read John 15 this morning. And so I did, and that's the one about the vine and the fruit and all that sort of thing. And it was 2 or 3 times today that I had conversations about that exact scripture. And I know a lot of you guys are shaking your head thinking, boy, this boy is slow on the uptake. And you may be right. You may be completely right. I may be really slow on some of this stuff, but it was just really cool. It was like, hey, look, you know, you put yourself, and it's John 15 was the scripture about being on the vine and the fruit that's from the vine. And if you're not on the vine, you're not going to make any fruit. And apart from him, and Jesus was talking to his disciples during that. And so I just thought it was so funny how what I put in my mind to start my day manifested itself in conversation throughout the day. I guess that's what I'm really trying to say. And it was I don't normally read scripture first thing in the morning, but I might start now that I've done that. It's not that I don't read scripture, but it's not my normal routine first thing in the morning. But it was inspiring. It was refreshing. It was enlightening to think about having that lead the day, I guess I should say. And I think there's some health in that. I think there's some health for me. Maybe I need some memory. Maybe I need a brain. I don't know what. Maybe I need to take more fish oil. I don't know. But maybe there's some health in there somewhere that says, hey, look, you can look like it would have been just as easy just to scroll through my phone, like have a cup of coffee and scroll through my phone, right? Like that would have been so simple to do. And I would have looked at some garbage on Facebook, or I would have looked at some garbage on X, or I would have looked at something like that. And then all day long, I would have just kind of manifested conversations around that. And that's kind of what we do, right? We manifest conversations around the things that we're familiar with. That's why on this show, it's kind of cool because one of the things we do to start the show is we talk about conversations. And it's like, what have I been talking about all day? What are some of the things that you might be interested that I'm talking about all day? And so when the pastor got here, I said, hey, I got an idea for you. I said, and I told him about it. And well, then he broke down John 16 and 17. He's like, just keep going because there's a lot there. And so now I said, now you got me all inspired. I can't wait. I can't wait for the next 2 days. Tomorrow we'll probably break down John 16, and then on Saturday we'll see what 17 brings us. And I'm a little bit excited about that I might get ahead of it. So that was good. So anyway, that was one of the conversations I had today that I thought was interesting. Another conversation that I had today that I thought was interesting was the statement that I had a lady that her hip was really tight today, and she said, I think, you know what, I really think it's the weather. I think it's the weather that made my hip tight. And it very well could be. And that is a thing that can happen. You guys know that, especially with joints, a lot around your knees or your shoulders or whatever. There is a joint capsule that's around a joint that has fluid inside that joint. Let me draw it for you. There's fluid inside the joint, and there's nerve supply on the outside of the joint. So I'll see what I can do here. See if I can just kind of make a joint. Well, so, and then what we've got is this It's called a synovial joint. A synovial joint is a joint that is encapsulated around it, and there's fluid on the inside of that joint. And so there's chemicals. We talked about over the last couple of nights the inflammation. I think last night we really hit it pretty hard about the chemicals that are inside of the body that create inflammation, right? Well, on the outside of that nerve, of that joint, you've got nerve supply. And so that nerve is coming, there's nerves that are coming down and they're crossing over and they're doing all kinds of stuff. And it's like there's nerves all around that joint. Well, barometric pressure changes with in the weather. Those barometric pressure changes actually change the pressure inside and outside of that joint. And it might cause some change in pressure between the inside of the joint and the outside of the joint, and some of that joint fluid might actually leak out. And if that joint fluid leaks out and it hits that nerve, it's irritating to the nerve. And that's where your joints would get sore from weather changes. And we all know it's true. I don't know like what the scientific breakdown of it is, and I don't know what the literature says about it, but everybody knows that's true. Somebody that's got a bad knee or a bad shoulder or something like that, they'll be like, man, we're fixing to get a change in the weather, because I could feel that out there. Like my knee's aching today. And then sure enough, the next day we get some rain or whatever. So I think that's a legitimate phenomenon that happens inside the body. And this explanation is the best explanation that I've ever been given as to why that happens. The barometric pressure changes the fluid inside the joint. That fluid leaks from the inside of the synovial joint to the outside of the synovial joint. And now all of a sudden you've got irritation of the nerve and your knee hurts. Okay. But I don't always think that's the reason. And I think when we deal in the unknown, whenever we're dealing in things we don't know, we kind of fill in the blanks with the things that we do know, right? It's just like, well, I don't know what it is, but it must be this. And that's kind of what we're going to talk about in the second half of the show, is sciatica. And so, and what that means, because people will say that a lot. It's my sciatic nerve. And it's like, well, okay, hang on a second. Let's talk about where that is and what the distribution is and all that sort of thing. And ultimately, it doesn't necessarily matter to the patient. They just don't want their hip to hurt or their leg to hurt or whatever. It matters to me because it's different based on what we're going to do with it, depending on where it's generating the pain from, right? But I don't think it always is the case that when the weather changes, that the joints should flare up. I think there's a chemistry issue inside the body that you could very well address. And this particular person this morning, and I love her to death. We have been taking care of her for several years, and she's been doing shockwave on her shoulder, actually, and she's been doing really well with it. But she said, I said, well, have you been eating any sugar? And she said, well, not any more than normal, but yes, of course, right? Okay, so I think it can be a combination of things. I think it can be a buildup of too many toxins inside the body. I think it can be a buildup of, or a change in fluid that has moved through the walls of the blood vessels into the walls of the nerves. And we went over that last year. I think my dad was dealing with that a lot. And that's where you have the bloodstream, and the blood vessel is actually got these cells that are all stuck together that makes that blood vessel. And then you've got these nerves that are running all along the outside of this whole thing. And then, so you got all this blood mixed with plasma inside your bloodstream. And if sugar actually gets, when you have too much glucose in the bloodstream, the glucose ends up getting taken into the cells of the blood vessels, and it gets stored in the form of sorbitol. And it will it will store that in the blood vessel. And now what you get when that happens, water follows the glucose. Just like in the kidney, water follows salt. Well, in the blood vessels, water follows this glucose that's coming in, and it's not through a channeled process. We don't need insulin for this to happen. This is just strictly diffusion across the membrane with the increased amount of glucose. If you increase the glucose on the inside of the bloodstream, down in the far distant blood vessels, down in your feet and in your hands, the ones that are especially down in your feet, you don't need to have insulin in order to get that glucose out of the bloodstream. That just diffuses across the membrane. And when it does, that glucose will diffuse from an area of high concentration to an area of low concentration, and then water will follow it, and you will start getting swelling in not only the swelling in the blood vessels, but you also get swelling in the nerves themselves. And then that creates some severe pain. Like that's a really, really big deal. So people often ask me, Doc, is there anything you can do for neuropathy? Because I've got some neuropathy in my feet. And I'm like, well, man, yes and no. It depends on how bad that damage is to that nerve. If it's super bad, then not a lot of the stuff we do will help. We do have some things. There are some shockwave that we can do around it, not necessarily on it, but maybe around it. We also have an Erconia cold laser that we can use to try to help with that as well. But the biggest thing that we can do to help that neuropathy is to keep that glucose under control. That's a really big deal, is to keep that glucose under control so that it doesn't diffuse across and swell up those blood vessels and nerves and just makes your feet hurt so bad. And one of the things, it's not just diet. It's not just diet that controls your blood sugar. And when I say controls your blood sugar, I'm not talking about you just eating just straight candy. I'm not saying that you're just eating candy. Any refined carbohydrate will increase your blood sugar quickly. Man, I'm telling you, if you guys don't know Justin Richard on Instagram, it's one of the best. There it is, right there, insulin resistant one. It just popped up. He's doing a deal right now on Coca-Cola. Let's listen.
Of carbohydrates, all of those carbohydrates come from sugar. This is the most popular soft drink throughout the world. People drink this more than any other soda. I want to see what it does to my blood sugar today. Obviously, it's going to spike. I want to see how quickly the spike begins and how high it goes. Let's give it a shot. All right, it's been over an hour since I've had that Coca-Cola, and I do want to add that I had this on an empty stomach after a 16-hour fast. So let's look at the blood sugar spike here. This went up by 34 milligrams. That's to be expected because of all the sugar in here. And when you're drinking beverages that are high in sugar like this, you can see that the uptake started very quickly. This blood sugar spike started climbing only 10 minutes after I had the soda. And the reason for this is that there is no fiber, protein, or
yeah, Justin
fat
Richards is great. It's called Insulin Resistant 1. And it's not scientific. He's wearing a patch on his arm, and he measures his glucose levels, and he just eats a bunch of stuff, and he does it, and he just shows you what it is. If you don't know who he is and you don't follow him on Instagram, I would just encourage you to do that. It's very simple. The whole thing lasts maybe a minute, something like that. He's just like, man, I'll just eat this, and he's got. He's got some gratitude, health in my blood sugar, supplements in my blood sugar, eggs and avocado in my blood sugar. And you'll see it, like when he eats eggs and avocado, it's like nothing. There's no blood sugar spike whatsoever. It's like we can listen to it right here.
This is 4 scrambled eggs cooked in some grass-fed butter, along with 1 medium-sized avocado. I've added some salt and pepper on this as well. This is considered be a ketogenic breakfast simply because it's high in protein and fat, and there are very little carbohydrates in here. Let's give it a try to see what it does to my blood sugar, and more importantly, I want to see how this makes me feel for the rest of the day. All right, it's been a couple of hours since I've had the keto breakfast. Let's have a look at the glucose monitor to see if anything happened. And no, there is no spike in my blood sugar.
Of course
It's
not,
nice
right?
even line
There's no
all the way
sugar in
across
there.
Not
It's
enough carbs in this meal.
there's not enough carbs to do that. So eggs and avocado for breakfast, and it's going to sustain you all day long because you've got fat, you've got good fats, um, and you got your protein to go along with that. And I'm telling you, there's some discussion about whether or not egg yolks are bad for you and all that sort of thing. As far as my body is concerned, and you guys have seen my blood work, I'm telling you, I eat scrambled eggs and sausage and or bacon like sometimes 4, 5, 6 days a week, and I've done that for 3 years and 4 months now. And my triglycerides are in the 40s, and my HDL is high, my LDL is normal. It's like my cholesterol is I don't know where they came up with that idea. And maybe there's science on it, but I'm telling you that I think I think high cholesterol comes from inside the body, comes from refined carbohydrates. Don't eat the biscuit with the sausage and egg. Just eat the egg, in this particular case, it's the avocado. There's mushroom chips, ice cream cone. He did an ice cream cone. You know exactly what's going to happen with that. Steak and potatoes, roasted potatoes. He just got a bunch of them. Cantaloupe, watermelon, all that sort of. You guys ought to go watch. We talked about watermelon this morning in the workout, and about about one of the guys said he got some watermelon at one of the grocery stores, and that it was the most delicious watermelon he ever had. And it's like, hang on, watch out with that watermelon. Your blood sugar is going to go up really fast with that. And I know it sounds crazy. It sounds, what do you mean? Like, I can't eat watermelon and cantaloupe in the summer? What's wrong with you? And I'm like, dude, just go look at what it does to your blood sugar. I mean, uh, it'll make.
Let's see what fresh cantaloupe does to my blood sugar. This is 6 ounces of fresh cantaloupe.
Let's just see what cantaloupe does to your blood sugar.
Calories, 1.5 grams of protein with 14.5 grams of carbohydrates. I like cantaloupe. It's a great treat, especially in the summertime. Let's see what it does to my blood sugar. All right, it's been a couple of hours since I've had the cantaloupe. Let's have a look at the glucose monitor to see what it did to my blood sugar. There's a spike right there. This went up by 30 milligrams, which I consider to be a significant.
That's a significant spike to him. It went up by 30 milligrams. Sorry, I lost you on the radio there for a second. But it went up by 30 milligrams. That's a significant spike for him with cantaloupe, right? And you could go through the whole thing, see if I could even find the watermelon. It's going to be more than that. Yep, there's watermelon.
Let's see what this fresh watermelon does to my blood sugar. This is 8 ounces of fresh watermelon.
I don't know if you guys can hear that.
15 grams of carbohydrates, and 1 gram of protein. And there's only 1 gram of fiber in this watermelon, so I'm wondering what it's going to do to my blood sugar. Let's give it a try to see what happens. All right, it's been a couple of hours since I've had the watermelon. Let's have a look at the glucose monitor to see what actually happened. Wow, there's quite a spike here. This went up by 49 milligrams.
Yeah, the cantaloupe went up 30.
But you should notice here as well, too, that the spike went up very quickly and then back down quickly as well. It was only a short.
Yeah, so am I saying watermelon's bad for you? Nope, but I'm saying it increases your blood sugar. And if you've got neuropathy in your feet and you increase your blood sugar, you increase the glucose concentration in your body, or fructose concentration, and that goes to your liver, and then that creates an inflammatory response as well. So you kind of got to watch out with those things. And so that diet is one thing. Okay, diet is one way to control that. Is to control the glucose in your bloodstream. And I just love that site. He does a great job with it.
Let's see what Coca-Cola does to my blood sugar.
And that's it's Justin Richards at Insulin Resistant One on Instagram, if you're interested in it. Okay. Another way that you control, we got just a couple minutes and then we'll get to sciatica on the other side of the break. Another way that you can control your glucose in your bloodstream is to increase your muscle mass. Increase your muscle mass. Because when you increase your muscles and then you use your muscles like lifting weights or body weight activities, just air squats. You can do air squats. You can do push-ups. You can do sit-ups. You can do like planks. There's lots of things that a person can do. You can do wall push-ups, that dips, just body weight stuff. If you increase your muscle mass and you work out your muscles will suck that glucose back into themselves, and that's another way that you can control the glucose that's in your bloodstream. So it's not just your diet, it's also your muscle mass. So as you age, what typically happens is you lose your muscle mass because you're not lifting weights or doing any sort of resistant training, and you're not moving your feet because of your retired lifestyle or whatever your thing might be. So now you're not moving your feet, and now you're decreasing the dopamine in your brain. So you're searching for an external source of dopamine. And now what's happening is you're eating more refined carbohydrates. And so you're doing two things at the same time. You're losing muscle mass and you're increasing your refined carbohydrates in your diet, which is increasing your blood sugar, which is making your neuropathy worse. And now you might actually have a hip joint problem or something like that. And you add that in combination with some other things, and then you'll say to yourself, I think it's the weather. And I'm like, well, maybe it's the weather, and maybe it's not the weather. And, you know, if you care, maybe you can control it. You can't control the weather, but you can control to a certain extent, the internal environment inside your body. Okay, we're going to take a break. We'll be right back. When we get back, we're going to talk about sciatica. I hope you guys will stick around with us. Yeah, we jumped around a little bit on that. Hang on. Listen, we're doing good. I hope everything's good in Waco. Everything seems to be good in Lubbock. It's all balanced in Lubbock. So, thanks for watching the show. Tell all your friends in Waco to watch the show, by the way. Say, hey, man, you should come check out this guy that's in Lubbock that talks about wellness every night from 6 to 7. That'd be awesome. We are going to talk about sciatica on the other side of the break. It's going to be a good conversation. You guys have, because I think you'll learn something. I think there's some good pictures right here, and we can learn something. And we'll actually let me actually pull up the definition. We'll go to our favorite place, the Cleveland Clinic. I don't really know anything about the Cleveland Clinic other than seems like they're working hard. I don't know. I don't have an affiliation with them. I don't know if it's good or bad or whatever. All I've always just thought, well, they put out some good stuff and they do a lot of teaching. So we'll just read what they have to say about sciatica. We're waiting on the commercials to be over on the radio. And if you got anything for me, you got any questions or comments, or what does Ken say on the morning, love or hate, whatever, send it to us. Tell your friends about our show. Tell your friends about the Rock Health and Wellness Center in Lubbock. If you got somebody in your life you'd like to see get healthier. I had one of my guys today ask me, he's a computer guy, and he's into advertising, marketing, and all that sort of thing. And he watches my show a little bit, and he's like, dude, like, if you should break your show down. You should make it 15 minutes. Do something really short instead of having this long show, unless for some reason you enjoy doing that. And I'm like, well, I got some reasons that I do it, but one of them is that somebody out there in the world might actually be listening to this show and getting healthier because they are. Like, that's what really, really drives me. And I think about my friend that died at 50 years old. If there's ever a day that I don't know what to say, or there's ever a day that I don't have the motivation to do this show, I think of Mick, and I'm like, dude, get going. Somebody out there is listening to you. So that's why we're doing it, and that's what we're going to do for the second half. We're going to talk about sciatica. Okay, everybody, we're back. This is Life with Jason Clemens, DC, and we are going to talk about sciatica tonight. For the last couple nights, we've broken down. We broke down flexion, extension. I thought we did a good job with that. And then last night, we broke down plantar fasciitis in the feet. So if you want to know something about that, go back and watch the second half of the show from last night. And then this afternoon, I just thought to myself, what is something else that's very, very common that people talk about all the time, and they get confused about what exactly. And I just thought one of them that just popped in my head was just sciatica. And what exactly is it? What do they say? What would the Cleveland Clinic have to say about it? What's the definitions? What does it actually mean? And so we're gonna do kind of what we've done for the last two nights, and we're gonna slow down just a minute and make it very plain and clear. My, my mom came in today and got adjusted, and she said, plantar fasciitis. I got it. And I'm like, great. She might be listening right now. But I was like, okay, like if mom got it, I think we're doing good. Like, so I hope a lot of other people got it too. So let's talk about sciatica. That's not a slight on mom. All right. Sciatica, according to the Cleveland Clinic, sciatica happens when irritation, inflammation, pinching, or compression affect one or more nerves that run down your lower back and into your legs. It's usually not a serious or dangerous condition, and most people with a sciatica get better on their own with time and self-care treatments. But severe cases may need surgery. So, when irritation, inflammation, pinching, or compression affect one or more nerves that run down your low back into your legs. What is sciatica? Sciatica is nerve pain from an injury or irritation to your sciatic nerve. So that's specific right there. And I'm going to show you again. I'm going to show you here in just a second what exactly is specific about that, right? That, like, why is that specific? So, and I'm reading this right from the Cleveland Clinic, right? Sciatica is nerve pain from an injury or irritation to your sciatic nerve. In addition to pain, it can involve tingling or numbness in your back or your glutes that may also radiate down your leg. More severe symptoms are also possible. Your sciatic nerve is the longest and thickest nerve in your body. It's up to 2 centimeters wide. A US penny or United Kingdom 1 pence coin are about the same width. I always think of it about the size of your little finger. It's a significant nerve, um, the longest and thickest in your body right there. Despite its name, it's not just one nerve. It's actually a bundle of nerves that come from 5 nerve roots branching off your spinal cord. You have 2 sciatic nerves, one on each side of your body. Each sciatic nerve runs through your hips, buttocks on one side. They each go down the leg on their side of your body until they reach just below your knee. Once there, they split into other nerves that connect parts further down, including your lower leg, foot, and toes. Having sciatica means you can experience mild to severe pain anywhere with nerves that connect to the sciatic nerve. The symptoms can affect your low back, hips, buttocks, or legs. Sometimes symptoms can extend as far down as your feet or toes, depending on the specific nerves affected. There are 2 different types of sciatica. Regardless of what type you have, the effects are the same. And the types are true sciatica. This is any condition or injury that directly affects your sciatic nerve, or sciatica-like conditions. These are conditions that feel like sciatica but happen for other reasons related to the sciatic nerve or the nerves that bundle together to form it. Healthcare providers tend to refer to both types as just sciatica. The difference between them usually only matter when your healthcare provider determines how to treat it, and that's a big deal. And that's something that maybe I'm right, maybe I'm wrong. I don't really know. I can tell you that it bothers me, and I don't know that I'm right. I'll just say this, but it does bother me when I just throw something into a big ball, like a big bucket, just to appease you as a patient. Like I really it bothers me to be wrong like that. It's like someone says, "Doc, my spine's out of alignment. How did I get out of alignment?" And I'm like, "Well, not actually. Like you didn't actually get out of alignment, right?" And then I know what they're talking about, and and probably if I was a little less analytical, maybe I would just be able to let it go. But sometimes I just can't let it go like that, right? And this is one of those cases where true sciatica. When I think of sciatica, I think of the sciatic nerve. It's like is where we've got compression somewhere on the sciatic nerve. If me personally, not the Cleveland Clinic or other doctors, but me personally, you've got nerve root distribution. You've got nerve roots, and those nerve roots go to places, and those nerve roots come together to make bigger nerves. And it's like, where is the problem? You come into me, we looked at a little bit of distribution when we were looking at cervical curves sometime this last week. If you come into me and you're talking about having pain in your thumb and your index finger, then I've got a specific area that I would go to in the cervical spine that would be related to the thumb and the index finger. But if you came into me and told me that your ring finger and your little finger were numb, to me that's a different area. I mean, is it in your neck? Yes. Are we going to do relatively the same things? Probably. Yes. So from a big picture standpoint, am I a little bit um, you know, over analytical on that? Yes, I do agree with that. I'm a little bit over analytical, and sometimes I tend to be that way. But it's different. It's to me. I don't know. It's like coaching. It's like, is it A gap or B gap or C gap? It's not just because they ran left. That we need to be more specific than that. It's like, which gap do they hit? Because we know which person's supposed to be in the gap, right? I guess maybe that's my background. So maybe I think of it that way. So when I think of sciatica, I'm thinking about true sciatica, not sciatic-like conditions. Because to me, sciatic-like conditions could be something that's totally different. And let me show you what I mean. So let's look at a picture here. And you guys on the radio, what we're looking for is, I want to show you this picture. And I've got two different ones here, but and this is teaching anatomy. Teach anatomy is where I got one of these pictures from. Let me see if that makes it. Doesn't make it much better, but we'll just try it like that. Okay. When they named nerves that exit the spine, they named them. Sometimes like the nerve root itself. It comes right off of the spine, and I'm looking at a picture of the lumbar spine and the sacrum together. The lumbar spine, there's 5 vertebrae in the lumbar spine, and they all have an L with them. And so it's L1 through L5. And when we're looking at them, that's what we're talking about. Okay. Then once you go past the L5 vertebra, you get into the sacrum, and it's got several different levels. And so S1, S2, S3, S4, like it goes down the sacrum, and there's multiple levels right there. So when those nerves come together, when a set of nerves exits the spine, sometimes those nerves will attach themselves together. So the nerve root of, in this particular case, L1, L2, L3, L4, you got 4 different nerves coming off your spine. They get together and they make what somebody named the lumbar plexus. The lumbar plexus is talking about L1 through L4. The sacral plexus, now we're talking about L5, S1, S2, S3, S4. That's a different thing. The sacral plexus is going to end up making the sciatic nerve. You're gonna get a different. Let me show you a different picture right here. And so, and L4 adds to that, coming out of that. You still the lumbar plexus and the sacral plexus, but in this particular picture, you can see it a little bit better where you've got L4, L5, and then S1, S2, and S3. And they're going to all come together. Now, there's branches off of that. And maybe this is too technical. Maybe I'm going too fast. We're talking about lumbar pain, and we're talking about where the distribution is going and how we're having pain with it, right? So L4, L5, S1, S2, S3 are going to come together and make that sciatic nerve, that big bundle, that big, thick, big as your little finger nerve, and it's going to run from your low back and your sacrum, which is sometimes hard to differentiate. People have a hard, they might not know for sure exactly if they're talking about L5 or L4. One of the things you can do is you can touch the hard bone on the side of yourself and find that hip bone. Find your hip bone with your hand and go to the top of the hip bone. And when you go right to the top of the hip bone, if you come right straight across to the spine from the top of the hip bone, you should be right on the L4 spinous process. If you just put your hands, you put your hands on your hips and you feel that soft area and you just go down till you find the bone. And then when you find the bone, it's like, okay, just trace it backward. That's L4. And if you went down, I don't know, 3/4 of an inch maybe, that would be L5. And then anything below that is your sacrum. So now you're getting into your sacrum, right? So when I look at that, and someone comes in and they're saying my leg is aching, my back hurts and my leg is aching. Well, where is your leg aching? Because there's a difference. Or they'll say it this way. They'll say, my sciatica is flaring up, and I'm like, okay, wait, where's the pain? And they'll be like, the pain's coming around to the front of the leg. And I'm like, nope, not in sciatica. It's not. We've got this distribution. See if I can make it. Yeah, there we go. So this distribution of what we're looking at here is we're looking at the front of the leg, and this would be the right leg looking back at us. And you can see the side of the leg over here, but you see the front of the leg. That when someone comes around and they say, my sciatica is really bothering me, and then they rub right across the front of their thigh. It's like nope, not sciatica, because we're talking about the L3 nerve root distribution. So L3 is above. It's not considered. It's not in that plexus. L4, L5 gets you down into the sciatic nerve. And when you get sciatic nerve problems, it's going to radiate down the back of your leg most of the time. That sciatic nerve is going to go down there just below your knee. Then it's going to split into those other nerves, and you're going to get all the way down into your foot. Right? So you'll get a nerve root distribution that's different, and it's not the same. So when I'm thinking about sciatica, I'm thinking more in my head, I'm thinking more about the lower part of the lumbar spine and the sacrum. What's going on with your sacrum? And is there a picture? Yeah, well, I've got it. We've got it on our other spot. What exactly is your sacrum? All right, so this is the one we were looking at. And we're looking at it from the back. And so what we've got is we've got the lumbar spine, and then we've got this big triangular bone spine that is part of the spine, this big triangular bone called the sacrum, and it goes all the way down, and it makes a triangle, and that's what your hip bones are attached to. And that's your SI joint, or your sacroiliac joint. This right here in the picture is the connection of the ilium right on your sacrum. That's your SI joint, the ilium and the sacrum. That makes up your SI joint. And you can see where the SI joint is right there next to the sciatic nerve. So now you've got these lower, the L5 and these sacral nerve roots that are coming across there. And now you've got that piriformis muscle that comes across. And a lot of times the, the sciatic nerve runs right underneath the piriformis muscle. And the piriformis muscle is attached to the sacrum, and then it comes across and attaches to the femur, that greater trochanter of your femur. That big area of the femur has that piriformis muscle. So if that piriformis muscle gets tight, it'll tighten down right on top of that sciatic nerve, and that's one of the things that causes that nerve, that distribution that's going down the back of your leg. And that's coming from, so now we're talking about your sacrum being imbalanced. The one thing that's the one thing that is good about your sacrum being imbalanced is that there's not a disc right there that's bulging. Now, you could have an L5 disc bulge that would be contributing to this pain going down the back of your leg, but most of the time, the sciatica and the SI joint it's not a disc bulge, and that's a big deal because it's not surgical. Like, unless you have some sort of, you're in a car wreck or something like that, or something that was really bad. I have a patient that's dealt with that. If you're not in that type of situation, then the SI joint itself is not surgical. It may hurt like heck. You may be in a lot of pain, but it's not surgical. And that, as soon as you know that, I think it takes a little pressure off of your brain, because it takes a little bit of that unknown away from you. And you're like, okay, I'm not going to have surgery, even though this hurts like heck running down the back of my leg. And that's where we would adjust the sacrum. We would adjust the ilium, your SI joint. There's a ligament right across that whole thing. Try to balance that up a lot, and that's where people, when that's off balance, they get those leg length discrepancies, like we talked about last week or two, and that pelvis being off balanced, rotated a little bit, sliding around on that sacrum a little bit, whatever reason, there's lots of reasons for that. That being a little bit, out of balance, puts your feet makes your leg lengths different. And we talked about that, some of the things that your body might do to change, to try to adapt to having different leg lengths. And I'm not saying that you have leg lengths. I'm saying that it's that SI joint that's rotated, or your sacrum is rotated, and that can be putting pressure on that nerve. And usually the sciatic nerve distribution runs down the back of the leg. Now, there's another area. Now, if you can see it, you guys on the radio, what we're doing is looking at a spine model here, and we're looking at it from the back. And the other thing is those facets. And another area that you can have pain that runs down the back of your glutes, down the back of your hamstring, can come from your facets. And the facets are the joints that are on the back side of each one of your vertebrae, and it goes all the way up. But in your lumbar spine, you have a facet between your sacrum and L5. You have a facet between L5 and L4, and L4 and L3. And usually the facets get jammed when you're doing lots of extension. Like if you've ever slept on your stomach and you had a big pillow, and you raised your chest up, like off of the mattress a little bit, or your hips sunk into the mattress, and you raised your head up, and you created an arch in your back. If you did that, that would jam those facets. Sometimes you can do it like going shopping or whatever. Stand for too long. If you don't have enough muscle tone in your abs and your back sways, and you jam the facets, you will get a bilateral backache. That means on both sides, right across your belt line. You could just right where your pants are, you'll get this bilateral backache, and it feels really good to like lean all the way forward and touch your toes. And then it will run when it radiates down the back of the leg. And the reason I say that is because it's different. It may not be vitally different to you from a standpoint of the fact that you've got pain running down the back of your leg. You may call it sciatica, and it's really facet distribution, which is it's kind of an argument of semantics to a certain extent, but not really, because it's like, look, it's not in the sacrum, it's in the lumbar spine. We need to address the lumbar spine and what's going on with the lumbar spine when we're talking about that same distribution. When we're talking about disc or lumbar problems, then we get a totally different distribution, and that's where that's this other picture, and that's where it starts to come around to the front of the leg. I just don't have any experience with sciatica, true sciatica, running down the front of the leg. It's not going to happen that way. You'll get it on the back side of the leg. You'll get all the S1 and S2. You can see this on this distribution here. That'll come all the way down to the outside of your ankle, and you'll get that down the back of the leg issue when you get into the sciatic nerve. But the lumbar nerves are going to come when you come around the front. I just get that a lot, and that's different because that could be surgical. Like you got pain running across the top. If you got pain running across the top of your thigh, and you just run your hand on the outside of just like if you're just sitting there and you put your palm of your hand right on the top of your quad, and you just run that down to the inside of your knee. If that's the pain distribution you have, or if you're saying it goes past my knee on the inside of my shin, or it comes past my knee on the outside of my shin, those are things that become more serious to me, because now we're talking about the possibilities of having a disc bulge. And a disc bulge, if you smash it, becomes surgical. That is more, that's a problem that we can really get into, and that could be dangerous. You got to watch out with the disc bulge. That's where oftentimes we run into people, especially males, and they'll talk about, they just want to toughen it out, or I don't need any help. I'll just toughen it out, whatever. And that's admirable. I'm all about man's man and all that sort of thing, right? The closer you are to the core, the more wisdom you might use on what's going on with your low back. If you're dead center in your core, and I've mentioned this before on the show, if you're dead center on the core, you need to be careful with that. I don't think you should, and I know a lot of people do, and they get by with it, but if you mess up your SI joint, so what? I mean, it's going to be painful and all that sort of thing, but most likely you're not going to have to have surgery. If you twist your ankle and you want to walk around on it all day long, okay, look, whatever. It's going to hurt, but it's probably not going to be that bad. I mean, it's not going to be like most likely hurt you down the road, right? Hurt your elbow, whatever. But when you get dead center in your core and you mess up that L4 disc or that L5 disc, and you now have pain running down your leg or inside of your knee or outside of your knee, or you've got foot drop and you can't pick your toes up, or that type of deal, like, man, that's dangerous. You got to watch out with that one. You don't want that to happen. So let's just recap real quick, because we've only got about 2.5 minutes left of the show. What are we talking about when we're talking about sciatica? In my world, we're talking about the sciatic nerve. We're talking about the L4, L5, S1, S2, S3 nerve roots. We're talking about it coming together, running right underneath. In some people, it runs right through the middle of the piriformis, but in the majority of people, it runs under the piriformis. It comes off of your sacrum. It runs down through what you would consider your glutes or your lower glutes, and then it's going to go right down the back of the leg. And you're going to get some distribution. You're going to get some pain. If you have some pain, then that is going to be on the back side of your leg with true sciatica. If you got it somewhere else, if you got it across the front of your thigh, if you got it on the outside of your leg, if you got it on the inside of your leg, more than likely, I'm not really thinking in my own brain, I'm not thinking that that's sciatica. I'm thinking we should look at the lumbar spine a little bit differently. Now, there's all kinds of fascia that's involved. There's all, like, you can have adhesions along the way. You can have tight muscles along the way that's pinching nerves and making problems. There's things, but that's where your doctor should be a clinician and be able to work through some of those things. Like, differentiate between whether or not I have facets or I have a disc. Differentiate whether or not we're talking about in down below in the sacrum or we're talking about in the lumbar spine. That's why specificity, I think, is important in these particular cases, because it you want to make sure that you're addressing the right area and not just throwing it all in there. Well, it's your sciatica flared up. And if you're gonna use that language, then you still ought to be responsible for doing it. So, hope that cleared up a little bit. I hope that made any sense at all about sciatica, and that's all I got for you on that. Hey, tomorrow night I'm going to be out on the town with my wife and mixing and mingling with other people. So we're going to do an encore show on the radio, and we are not going to have a social media show tomorrow night. So hope you guys have a great weekend. We'll be back on Monday live, and we'll have an encore show on the radio tomorrow. You guys have a great weekend. Let me know if I can help you. Thanks for watching this show.